News of the coronavirus has generated conflicting messages. We discuss the latest developments and discuss preparedness for you and your family. It's all here on the next Latino Motion. Join us.
Choose to get lost in the woods to gain experience in forest management.
Choose to travel through time to understand the past.
Choose to soar to pursue a career in dance.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation, and Stockton University. This edition of Latino Motion with Bert Lopez is brought to you by the HD Studios at the campus of Stockton University. Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger, Atlantic City Electric, energy for a changing world, and South Jersey Gas. Welcome to Latino Motion, a weekly interview show highlighting issues impacting New Jersey's Latino community while advancing understanding of Latino cultural heritage and contributions to our society. And here is your host, Bert Lopez.
Buenos dias and welcome to Latino Motion. I'm sure that you're already overwhelmed by the constant news around the coronavirus. My guest, Michael Heck, is here to add some clarity around the conflicting messages we're hearing. Michael, welcome to Latino Motion.
Thank you, Bert.
So there is a lot of conflicting messages. A lot of this covered in the news, is making news every single day. What's the key facts that we should know about this virus?
At AtlantiCare, we'd like our community to know that over 80% of cases of coronavirus, this strain specifically, fortunately, present as cold-like illness, flu-like illness, mild illness.
So those are the symptoms, essentially? So there's nothing different than the same symptoms you would face if you were having the common cold?
Most of the symptoms are the same: fever, sore throat, congestion, coughing, sneezing. Shortness of breath can really be a hardship in this case in some people.
Let's talk about what preparations are underway at the hospital. You're obviously in the infectious diseases unit at the hospital, and you are preparing for this and been prepared. Tell me what some of the preparations that are taking place.
Certainly. Well before coronavirus, at AtlantiCare, we work together as teams and we monitor the situation throughout for flu-like illness, increase in flu around our area to make sure that we're prepared to be able to take care of our community.
Let's talk about the differences between the flu and the coronavirus, and in terms of the number of deaths. We seem to think that the corona is a lot more deadlier than the common flu. Is that the case?
So overall, you talked about the numbers. The flu is a pandemic worldwide every year. We're concerned right now about coronavirus reaching the point of being a pandemic, but people don't realize flu is a pandemic every year. There are millions of cases and thousands, hundreds of thousands of deaths worldwide. So in comparison, the numbers, flu is much more deadly overall, just this season alone.
Let's talk about the flu shots, and people recommended that they take the flu shot. Does this help with the coronavirus?
As far as we know, the flu shot does not help with coronavirus. However, we do want people to be vaccinated against flu to help protect them against flu itself.
Yeah, but like you mentioned, the flu is deadly just as well, and you could rule out the flu if you had the flu shot, for example.
Well, not 100%,
okay,
but it has great protection. So it should minimize the signs and symptoms and need for hospitalization in people who are vaccinated. Over 73% of people that we're seeing through our emergency rooms for flu have not been vaccinated. Wow. That's a staggering number.
That's a staggering number. And the flu shot you could get at the drugstore. You could come into the hospital or right into the clinic or your doctor to get a flu shot.
Flu shot's still available all over and will be available until the end of flu season, which usually is until the end of March. Sometimes it goes until the end of April, depending on the situation. In New Jersey right now, flu activity is still quite high.
So what should you do to protect your family from the coronavirus?
If you are sick, stay home. That helps protect the people around you. To protect yourself even before that, wash your hands, soap and water, or alcohol hand gel, at least 60% alcohol. Not touching your face is a key factor. It's spread by droplet, definitely, potentially some airborne. That's still being investigated by CDC. But wearing a mask for most people is not going to help, because even when you wear a mask, we touch our face so often that people are touching their face even more often when they wear the mask. So that presents a danger in itself.
I often heard that the mask doesn't really help, right? That the surgical masks are often used for someone that is sick.
If somebody wears a mask because they are sick, that's a completely different situation. If anybody feels that they might need to wear a mask because they're in a high-risk group, as an example, chronic heart conditions, lung conditions, immune suppression, they need to check with their doctor before just going out and buying a mask, because it doesn't provide the protection that people think it does.
All right, that's the surgical mask. There is a specialty mask that's fitted, basically.
I'm glad you brought that up. That specialty mask needs to be fit tested for people who use it, such as healthcare personnel. People cannot just put on a mask and be assured that it's going to create a proper seal and protect them. It's for taking care of somebody who has an airborne illness, not for the public just to wear out and about.
What's your recommendation in terms of you're feeling sick, you think you have the flu, stay home versus going to the doctor? At what point should you be visiting the doctor?
If you feel ill, contacting your primary care provider is the thing to do. Call first, and then take their advice on what to do. The doctor may want to see you, the provider may want to see you, they may want you to go to an urgent care if it's after hours, or, if need be, an emergency room under very serious conditions.
And is AtlantiCare doing testing for coronavirus?
AtlantiCare doesn't do tests at AtlantiCare. There's very specific criteria that the CDC and Department of Health follow, and AtlantiCare is involved in collecting samples as needed. We've not had that happen up to this point.
Oh, very useful information. We're going to continue our discussion. We also have the health department here. We'll be right back with more Latino Motion.
Latino Motion with Bert Lopez is presented by Latino Motion Public Affairs Media, a New Jersey nonprofit corporation. Join us online at www.latinomotion.tv. Find us on YouTube, Facebook, and Twitter. We encourage your comments and contributions for show topics.
Welcome back to Latino Motion. Governor Phil Murphy and Atlantic County Executive Denny Levinson have declared health emergencies in light of the coronavirus. What does this all mean? Well, Christine King is here to join us to tell us what this means. Christine, welcome to Latino Motion.
Thank you. Thank you for having me.
So tell me, from the Department of Health of Atlantic County, you've heard the statements from both the governor and the county exec.
Yes.
What does these emergencies really mean?
So what it means is it allows us to ramp up our efforts to contain spread. Here it triggers other executive powers and safeguards, such as prohibiting excessive price gouging. It also gives agencies a leeway to waive some of the processes and procedures to allow for more access to services, to goods, to things that we may need to help contain the spread of it in our community.
So this is the trigger, basically, to prepare.
Exactly, exactly.
Let's talk about what you at the Department of Health is doing to spread the information and educate the community about this health crisis.
So we have sent out letters to our municipalities, our libraries, our schools, all of our other public health partners, providing educational programs so that the community knows what it is, what they need to do to stay safe, and how they can prepare.
We heard AtlantiCare speak about the symptoms of the virus. Do you see it the same way? It mimics the common cold?
It absolutely does, yeah. People are experiencing those flu-like symptoms, the coughing, respiratory illnesses. That's exactly what is happening with this as well. It can seem like the flu, but they're the same symptoms.
So what is the county actually doing to prepare?
So we are working with the New Jersey Department of Health and the Center for Disease Control to stay updated and informed. We are given guidance by them, and then we disseminate to our public health partners so that we can all be on the same page.
So we see other communities where schools are closing and they're taking precautions. In fact, some are even canceling public events.
Yes.
Is that happening in Atlantic County or in South Jersey here?
Right now, as of this moment, that is not happening in Atlantic County. It's a way, though, those efforts are to implement the social distancing, people maintaining space between each other to prevent spread of germs. So that's the main goal in canceling those things.
Now, school systems, obviously, they consult with health providers. Did they consult with the health department?
Yeah, we presented to them just recently guidance documents, and we met with all of them so that they know that, you know, we are there to help them make the decisions that need to be made.
What do you tell the general public, particularly those who may be taking their own steps to curtail contact with the public, maybe curtail travel? Is that a good idea?
Well, it's strongly recommended for those who are vulnerable. With this, we know it's the population that is like 60 and over, and especially if they have any other underlying health conditions, it's recommended for them to be extra cautious in where they travel.
Let's talk about testing. Is the health department doing testing?
Our health department is not doing testing. We offer our communicable disease nurses, though, monitor cases. That's what their primary job is. We receive calls from healthcare providers, and we offer them guidance as well. That's what we are doing. The testing is being offered at the state level at this time still, yes.
Now, we also heard from AtlantiCare that you should take precautions now against the common cold.
Flu activity is very high right now, so the same precautions you would take for flu, washing your hands frequently, keeping your hands away from your face, it applies the same to this respiratory illness. That's what's recommended.
So how important is for people to get educated and to remain calm on this issue?
It's very important. Right now, it's not the time to panic. It's the time to just prepare and practice those actions that will keep you healthy. As I mentioned, keeping your hands away from your face, covering your coughs and sneezes, washing your hands frequently, stay home if you're sick. It's very important just to maintain those actions right now to stay healthy.
And I know that there's Center for Disease Control and Prevention has information on their website as well as the New Jersey Department of Health.
Yes.
And there's also on the county site as well.
Yes, www.aclink.org. Go on there. We also have information.
We want to talk more about preparedness, so
Yes.
we're going to take a quick break.
Okay.
We'll be right back with more Latino Motion. Welcome back to Latino Motion. In light of the coronavirus, many of us are looking for direction to be prepared. I'm once again with Michael Heck and Christine King to discuss that very topic. And today, March 10th, the date of this taping, but just recently we heard from Sheila Oliver, the Lieutenant Governor, saying that we need to be prepared for at least 2 weeks. Tell me a little bit about that preparation.
So It's recommended that you have a 2-week supply of food and water in your home. In the event that you should become ill and you need to stay at home for that period of time, you have adequate supply of food and water. Also, your prescription medicines, make sure you have adequate supply of them at home as well, and over-the-counter medicines such as the anti-inflammatories, all of those sort of over-the-counter prescription medicines or non-prescription medicines that you would need.
And of course, Michael, when someone calls sick, they stay home because they feel they got the cold, the flu. That's also an opportunity for them to go shopping and do other errands. Is that recommended? When you stay home, should you really stay home?
Absolutely. If you need to stay home because you're sick or your provider tells you need to stay home, it's actually staying home, not going out to eat, not going shopping. Have someone else outside help you for those things that you need to be brought to your home.
So let's talk about what kind of items you should have at home, particularly if you're going to keep that supply, sort of like the shelter in place. What materials do you need?
So other than your canned goods and things that do not expire that you could continue to eat, and bottled water if that is what you choose to have as opposed to the tap water, you should also have adequate supply of cleaning supplies, toilet paper, paper towel, those sort of everyday things that we use. It's also recommended that to have enough pet supplies if you have a pet, so that if you're told to stay at home or if you're sick and you need to stay at home, you have everything you need right there.
You mentioned medication, right? You make sure that you have the adequate amount of medication as well. Michael, I know that the hospital has taken some precautions, and there are some restrictions on even visitations. Tell me about that.
So at AtlantiCare, visitor restrictions actually started in December because of flu activity, where children under 14 are not able to visit our high-risk areas such as intensive care, pediatrics, labor and delivery, our cancer care institute. More recently, we've enabled our enhanced restrictions, so no one who is sick should visit other patients at the hospital. Of course, if you're sick yourself and you need to be seen, contact your provider. AtlantiCare will help you.
Yeah, and obviously the county has a number of facilities, including a nursing home. You're also imposing some of those restrictions.
Residents who have family members, if you're not feeling well, please stay home. Do not come see your relatives.
And as we've seen in the state of Washington, nursing homes are particular high risk.
It's that population that's 60 and over group, especially those with underlying health conditions that are particularly vulnerable right now to this virus, yes.
Now, what can you tell me about the contact information? I know that there's a couple websites, and there's also a state hotline. Can you tell me about that?
The New Jersey Poison Control Center opened a call center in conjunction with the New Jersey Department of Health, and that's for public callers. Anytime they have a question, they are open 24/7. They're available in multiple languages. That phone number is 1-800-222-1222.
Yeah, very, very important, and obviously the first line of defense is really your professionals, your primary care doctors. But if you need to call that number, that's a hotline.
Question? Sure, yes.
Let's talk a little bit more about preparedness, not just shelter in place, but to make sure that you're not spreading or contracting the virus. What are some of the recommendations? You mentioned the hand washing, but what about surfaces? I mean, could the virus also be lived in surfaces?
So the virus can be viable on surfaces, and it ranges at this point since we don't know everything about the virus yet. The thing to do is to disinfect surfaces. Household disinfectants will work nicely. They need to be disinfected often. It's not a very hardy virus. Your household cleaners and disinfectors will work nicely.
Yeah, we have seen that on TV when you've seen some of the airport, for example, being disinfected to make sure that the surfaces don't serve to carry the disease. What other precautions do you feel for the older population should be taken?
I think that one of the main things is anyone who has any signs and symptoms of any illness should be very careful and change plans when visiting someone in a high-risk population. Perhaps you need to not go to grandmom's birthday party at this time if you're not feeling well. That could be excessively dangerous.
Oh, very good. And I know that the health department still has the opportunity to give flu shots.
Yes,
Can you tell me about that as well?
Flu shots are still available at the Northfield location Monday through Friday, and those hours are 9 a.m. to 12 noon at the Stillwater Building at 201 South Shore Road in Northfield, and at our Hamilton location every Tuesday from 10 a.m. to 12 noon at 310 Bellevue Avenue.
So just to wrap up, Michael, what's the best advice you could give our audience in terms of this virus? What's the takeaway?
Wash your hands often, soap and water or alcohol hand gel. Don't touch your face, and don't panic.
It's not the time to panic. It's just time to prepare and practice those measures to stay healthy.
Well, thank you so much for sharing this information with our audience. Very, very important information. And thank you for joining us at home once again here on Latino Motion.
Choose to get your feet wet. To learn more about protecting our environment.
Choose to read minds, to understand the human brain.
Choose to get your hands dirty, to create a masterpiece.
Stockton University offers 50 high-quality academic programs, small class sizes, and affordable tuition. Choose to match your interests and talents at one of New Jersey's nationally ranked universities.
Funding for Latino Motion is provided by AtlantiCare, a member of Geisinger. Atlantic City Electric, energy for a changing world. And South Jersey Gas.